I grew up with a head and neck surgeon, or ear, nose, and throat surgeon, and my uncle is an orthopedic surgeon, and so yeah, surgery has been a big part of our family. My mom was a nurse, and so I remember going to my dad's office a lot and watching him do procedures and talk to patients and really change people's lives and improve them very quickly. And so that definitely inspired me, and I think my injuries over the years in sports, a broken heel, a broken back, shoulder injuries, and broken hand, those things really got me interested in orthopedics and doing therapy. Seeing an orthopedist doing therapy in high school and as a swimmer, made me very interested in it. But I think in college I shadowed Dr. Veenstra in Kalamazoo, and because I was at Calvin College, or Calvin University now, and he really changed my mind, shadowing him and watching him. And so then I switched to pre-med and decided to move forward with that. And that was a journey. It was very hard work. Then I went to Loma University School of Medicine, and when I was at Loma, I did a lot of missions and spent 3 months in Honduras, just me and occasionally someone else, just learning Spanish and being at a small little community hospital with a Cuban doctor, delivering twins one day, and playing on the high school soccer team there. That I spent a month there, and then I spent a good couple weeks at an orphanage there and with the little kids, and then I spent another big amount of time in the big city working at the big hospital and stuff. But that was just a cool experience, confirming that I really want to do orthopedics. So that's what I set out to do, and went to McLaren residency program in Flint, and I saw there's a lot of gang violence and gunshot wounds every day, and obviously car accidents, big injuries. But at Hurley Medical Center, I really learned how to do a lot of trauma. We went to Dayton, Ohio for my trauma fellowship and spent a year there. And then I practiced in Kalamazoo for a couple years at their level. I was the traumatologist for both level 1s back then, and I think Borges is a level 2 now. And then this was a much more family-friendly place for me, where I could do a lot of trauma, but still have a better lifestyle. And now I have 9 kids, and so family is very important to me, and being able to be home and be with my family, but still very busy in taking care of people that are broken here and restoring them. So it's a very rewarding career. It's very it does ask a lot of you, your time and energy, and but it's definitely worth it. I love coming to work every day. I love doing what we do, and the patients make it very worthwhile too. You kind of heal people's spirits a lot of times, and not just their body, because their life, you can see the light bulb go back on after being through a difficult time, because it is very draining mentally and physically to go through chronic pain or have your life flipped upside down in an instant. So that's really cool to be part of.